It's general belief that when you chew bone, your teeth get stronger.
They get weaker, and especially as you age, the content, the water content on the teeth gets smaller and smaller. So of course, where you don't have much water, it becomes brittle. So the teeth tend to get brittle as you age. That is the time not to. Even when you're young, you're not supposed to. So if you want to keep your teeth for the rest of your life and have them looking nice. And I mean looking nice, even that Hollywood smile without having to do cosmetic procedures, then you should not chew bone at all.
But is it the fish bone or the real bone or the seed bone? Please, doctor, just give us specific, because some people have sat there down in the house, they are listening. Because this bone, they cause wala for us. Please clarify those for us. You clarify it for us. Thank you.
Doc.
Just remember one thing. If you expose your teeth to the wear and tear of anything that is not gentle like meat, soft fish, chicken and stuff like that, it's going to destroy your teeth. So choose your battle and just make sure you take good care of those teeth. They're very precious, because that's why dental procedures are so expensive, because it's time consuming. You don't want to get into the problems of having to reconstruct your mouth because of bone. It's not worth it.
Wait, so I'm sure people will still ask questions about bones, but I want to take you up on the reconstruction now. Is this the same thing as cosmetic dentistry? Are they the same or they're different?
So when you talk about mouth reconstruction, you're taking care of practically every single mouth in the body, and this is a very expensive procedure, time consuming. You could go through 4 months, 6 months just to reconstruct your mouth. So it also involves cosmetic dentistry, because you are taking care of the outer, the smile that you see. So it's a combination of the Hollywood smile and the taking care of the back teeth, so that you can chew properly and you can smile properly and nicely.
How many times to brush in a day or floss in a day? Yeah.
I'll always advise for everyone to try to brush after every meal, but if that's not practical, then do at least twice a day before you go to bed. That, by the way, that's the most important time to brush and floss. Don't forget to floss, because that's the only way to get in between your teeth. So in the morning after meal, and in the night before you go to bed. In the afternoon, try to have some apple or something that will cleanse the mouth, so that you don't leave all that plaque in your mouth. Plaque is the dirt that you brush off.
Did you say in the morning after meal?
After meal. So if you're so used to brushing before meals, brush before meals, but make sure you brush after meal, after your breakfast.
Is this a common practice?
It is a common practice. Once you know the implications, you tend to do it that way.
I'm hearing so many things for the first time today. After meal?
After meals. Because you're introducing dirt into your mouth when you eat. You're going to leave the plaque on the teeth. So the only way to get rid of the plaque is by brushing after meals. Really, before meal, there's really not much to brush.
Yeah. And how about the smell when you wake up in the morning?
Yeah, the smell. That if you're concerned about the smell, then brush. Or you can just use mouthwash.
Okay.
But make sure you also brush with a soft toothbrush. You don't ever brush with a hard or medium toothbrush. And even with a soft toothbrush, make sure you brush gently. You don't want to destroy the enamel. Remember, the enamel is the king.
Why do we believe that until when you do before your mouth is clean? Why do we believe that?
I don't know. This is it's ridiculous that they're teaching, and they're even selling medium toothbrushes and hard toothbrushes in Nigeria. I saw an ad the other day, and it was advertising medium and hard toothbrush. Don't do it. Just stick with a soft toothbrush. Make sure it's written soft on it.
Wow. All right. Let's go take questions now. Look, Doc, these are the calls that are coming in. So let's take them one after the other. Good morning to you.
Good morning, oh.
Good morning.
Mr. Sherry, I've been laughing my head off. I'm bro. Is it that Bogo?
Bogo, you know.
I have 2 questions, doctor. You said gum disease. Is it transferable? That men and women. I don't want to talk already. You understand what I mean? Maybe they are into that.
During intimacy.
Is it transferable?
Okay.
1. Then 2. You said toothbrush should not be hard. If I think of coin, I will use it on my teeth. I use extra because I think they are not clean. To me, if the toothbrush is too soft, it's just as if I'm using my finger. No, I want something. So where am I?
There you go, Doc.
So talking about whether it's transferable or not, the gum disease. Well, there a lot of questions about that, and it hasn't been proven that it's transferable. But then, if you want to kiss your mate, try to just make sure you have a clean mouth, right? I think that's only polite and respectful of your partner. Regarding the toothbrush, remember, if you brush hard or you brush with a hard toothbrush, you're scraping away the enamel. Like I said, the enamel is king. You want to preserve the enamel. Even if you're going to have that Hollywood smile in the future, you need the enamel to keep the veneers in place. If not, the veneers will just be popping off.
Yeah. Yes. Let's take another call, Doc. Good morning to you.
Good morning, Sheriff.
Yes, please.
Yeah, Emmanuel calling from Agoda.
Welcome, Emmanuel.
Doctor, if I use a brush, I'm in trouble. But if I use chewing stick, I'm free. So what's the problem?
It's asking about chewing stick. Is that all, Emmanuel? Is that all?
Yes.
Okay.
All. Thank you.
All right. Chewing stick.
The chewing stick is not a bad idea, but where I find chewing stick terrible is the fact that you're going to chew the stick before you get it to be soft enough to brush your teeth. So that is hard. The stick is hard, so you're damaging your teeth. So if you can find a machine that would get the chewing stick soft, I mean, you get that spongy thing, then you can brush your mouth with it without having to chew. But if you have to chew the chewing stick, you're damaging your teeth. That's the only thing I have against chewing stick. I like the effect it has on the teeth, but definitely you're going to damage your teeth by chewing on that hard stuff.
Yemi is Nayabo, and he or she sent us a WhatsApp message. Said, you mean hard brush is bad? There's how about the use of whitening toothpaste? I mean, it's part of the questions I have here in the first place. Is there anything like whitening toothpaste?
Yes, whitening toothpaste is all over the place. It's a way of the toothpaste manufacturers to sell their products. But is it efficient or effective? No, it isn't. Unless you whiten your teeth with the whitening product we have in the dental office. And by the way, I mentioned dental office because if you go to all these spas, there's a tendency that they're just going to damage your gums and your teeth. So you need to go to the professionals to make sure that you're getting the right treatment. So yes, you can whiten your teeth, but
not through toothpaste.
Not through toothpaste.
Okay. 8:39. Let's take another call. Good morning to you.
Hello, good morning, Sherry. Fantastic show you guys are having. This is Alex.
Thank you, Alex.
Yes, Doc, my mom is quite elderly. She's been complaining about tooth sensitivity. Well, she didn't say it was tooth sensitivity. I was the one, when I went on a visit, I was the one who concluded that was tooth sensitivity, okay? But there is something else that my sister told me, because my sister lives with her, that she's been trying to discourage her from using this white powder. Some stuff that they sell in traffic or everywhere, white powder that they say it strengthens the teeth, it makes it white and all of those things. I am thinking in my own mind that thing is some raw chemical. I don't know, would you want to speak to it?
Okay. All right, Alex. Thanks for calling.
So I wouldn't know what exactly that chemical is, but if you can't prove it, so don't use it. But then some people tend to use baking soda to brush the teeth. it's an abrasive, and even with the abrasive, all toothpaste have abrasive, but you don't want to use too much of it, and that's why you also want to use a soft toothbrush so that you don't wear off the enamel.
Okay. Gloria on WhatsApp says, what does one do to a cracked teeth and recurring sore throat?